How do doctors measure medication adherence? Have you ever wondered how doctors keep track of whether patients are taking their medications as prescribed? This is especially important in the context of mental health and addiction. Let's break down how this measurement works. Doctors use two main categories to assess medication adherence: direct methods and indirect methods. Direct methods involve verifying that the medication has actually been taken. One way to do this is through biological samples, like blood or urine tests. These tests can measure the drug or its metabolites, confirming whether a patient has ingested their medication. Another direct method is direct observation of therapy, where a healthcare provider watches the patient take their medication. However, this method is not commonly used outside of controlled settings. On the other hand, indirect methods relying on patient self-reporting. Patients may share their medication-taking habits through interviews, questionnaires, or medication diaries. Standardized tools like the Morisky scale or Hill-Bone scale help estimate adherence. However, self-reports can sometimes be biased, as patients may unintentionally overestimate how well they follow their medication schedule. Another indirect method is pill counts. During clinic visits, patients can bring their medication containers, and healthcare providers count the remaining pills. This helps estimate how many doses were taken. However, this method can be manipulated if patients discard pills before their appointment. Pharmacy refill records are also an important tool. By tracking how often patients refill their prescriptions, doctors can gain an objective measure of medication possession. A common metric used is the proportion of days covered, which indicates the percentage of days a patient has medication available. A proportion of days covered of 80% or higher is generally seen as good adherence for chronic therapies. Electronic monitoring devices, like smart pill bottle caps, are becoming more popular. These devices record when medication containers are opened, providing detailed adherence data. However, they only track container openings and do not confirm if the medication was actually taken. Sometimes, doctors assess adherence by monitoring clinical responses or physiological markers related to the medication's effectiveness. While this method is less precise, it can still provide useful information. In the realm of substance abuse and addiction, measuring medication adherence is particularly vital. Non-adherence can lead to relapse or treatment failure. For instance, in medication-assisted treatment for opioid use disorder, ensuring patients take medications like methadone or buprenorphine as prescribed is essential. By combining various methods, doctors can create a more accurate picture of medication adherence. Each method has its limitations, so using multiple approaches helps tailor interventions to support patients in maintaining their treatment regimens effectively.